Kevin, as we look at this a little closer, the health impacts of the coronavirus are greatly downplayed by some people as they say, well, what's the big deal? Since we have between 29,000 and 69,000 Americans die each year from complications arising from the normal flu virus. And yet, at least from what we understand here, the normal death rate from influenza is in the area of 0.2% range, while the COVID-19 death rate is generally regarded as being the 2 to 2.5% range. So just share with our audience, if you don't mind, how significant this difference really is.
Well, two areas is significant. We don't know what the actual death rate is going to be because we don't know exactly how many people have the COVID-19, the novel coronavirus. But over the past 10 years, 200 million people have been afflicted with the flu, and some that counts people who've gotten various flus through the years, but 300,000 people died. The problem, because there is no immunity to this disease, some estimates are that you could have as many as two-thirds of the population, which would be about that 200 million people. Even if it had the low death rate of the flu, that'd be 300,000 people dying all at once. So that's a scary thing. And it may be that the death rate is exaggerated because we're undercounting the number of infections. But if it spreads that rapidly because there's no immunity, that's where people get concerned, and that's where you have schools closed and that sort of thing. And then you have the tragedy. Any flu death is always tragic, but if it happens all at once, it's very tragic.